Good afternoon, everyone, and thank you again for joining us for what should be an amazing conversation today, a part of our Key Lecture Series where knowledge empowers you. We are very excited for you to be joining us today for what should be another amazing conversation. We are joined by an amazing speaker, community health advocate, community health worker, public health professional, professor, lecturer, et cetera, et cetera. We're joined by an amazing young lady today, Dr. Kevicha Echols from our community health department at Kingsborough Community College, where we're going to have a conversation not just about our community health program, but also about coronavirus, how it's impacting communities of color, as well as what the community health profession is doing to address this pandemic, as well as moving the healthcare profession forward in community health. So Dr. Echols, thank you again for joining us for what should be an amazing conversation today. So I guess you can start by just telling us a little bit about your background, what brought you to Kingsborough, what a student can expect to learn from the community health program as far as like internships, courses, different things like that. And then we can talk a little bit more about, like I said, the community health program in general. But I guess you can start by just telling us a little bit about your background.
Okay, thank you again, Micah, for having me. I'm happy to be here. So again, I'm Kevicha Echols. I teach at Kingsborough in the community health program in the Department of Health, Physical Education, and Recreation. I actually came to Kingsborough while I was still in graduate school working on my dissertation. So my background, I'm a sexologist. My PhD is in human sexuality. And much of my research actually has still been health related, even though it's sex related. But my research was on the sex work industry. And so what I did was I was looking at the history of sex workers actually advocating for themselves through publication. And some of the important, interesting information that came out of there was the fact that sex workers have really been advocating for their health and rights for almost 3-4 decades, especially with the HIV crisis. So when I thought about what I was doing in my field of sexology, and then once I came to Kingsborough, it's like my health experience came full circle, because we often talk about minority populations in sexuality and in health. And these are usually populations that may experience health disparities at higher rates than other communities for various reasons. Obviously, in my research and field, sex workers experience health disparities because of the nature of their work, the stigma surrounding it, and also the legality. But I came to Kingsborough in about 2009 as an adjunct. And once I defended my dissertation, I was able to come on board at Kingsborough full-time in the community health program in 2012. So I've been there for a decade now. But about our program, so we have a 2-year degree program in community health. So we actually have 2 tracks now. We had a 3rd track that we actually are revamping right now. But we have health education and promotion. We have health services administration. And the one that we're getting ready to revamp is gerontology. So with the 2 different tracks, I really tell students it depends on what you want to do. Students who are interested in management and maybe moving up to the level of public health advocacy and policy making and things like that might be more interested in a health service administration major. These are people who eventually may be finding jobs in hospitals, clinics, and places like that, even nursing homes. And then our health education and promotion program track is for those students who are looking to be health educators, health advisors, program creators, program managers, and things like that even. So we like to say that community health is the kind of major that is a foundation for lots of other health-related types of fields and careers. We consider it the boots on the ground, right? So you have communities experience different types of conditions based on a number of factors. We a lot of times we call this our social determinants of health. And so students who are more interested in maybe focusing on populations and persons and things like that might be more interested in health education and promotion, because these are actually students who will be out in community. Our health service administration students may be as well, but they may not be in contact as much with populations. They may be behind the scenes more so. So it really depends on what students are looking for in their experience. That's going to determine which track they take. Oftentimes we have students of all ages, obviously, but a lot of students come to us for getting a degree to advance where they are currently in their fields, because some students already have health experience. They're coming to us from being in the field. And then we have students who sometimes come because they want to change their field. A lot of times people have, I mean, if you're a human being, you have a family of some sort, and you've been around people who've experienced health issues. Sometimes those health issues may motivate you to want to go study and become someone who works in the health field, which is some of the cases with some of our students as well. One unique thing I do want to share about our program, though, is that we do require all of our students to do an internship. So unlike some programs in health that might be more clinical, we require our students to do 100 hours of field work. And again, this is based on whatever their interests are. I'm actually the field work coordinator for our program, so I treat it as a job readiness and development course. And I tell students, this is a chance to get experience in something that you think you'll like, to find out if you will like it or if you need to change your mind right now. Because one of the things going out into the field is job satisfaction. You know, a lot of people aren't satisfied with their jobs because they don't like what they do. So I try to get students to hone in, which is the course, this is the course they take in their last semester anyway. So this is that opportunity to get your feet wet in the field, but also to gain some experience to determine if this is the right field for you. Some people don't find that out until they actually get in the field, but we know the health field is something that constantly is in demand. So more than likely, people are going to always enter this field, and there's going to always be jobs available.
Right. And that's so important that you mentioned that about giving the students an opportunity to, you know, get their feet wet and experience different internships out in the field, because I think what we're seeing now, especially with the way, you know, COVID-19 is impacting communities in New York, especially the communities of color, now more than ever, those frontline workers, those, you know, mental health providers, those individuals that work in community health are really being tasked with, you know, being on the front line and really being face to face with some of these people that are being impacted the most. So I guess what role would you say that, you know, community health workers in general, or, you know, public health, or some of those health promotion employees or individuals that go into those careers, how important would you say those roles are right now with addressing this disparity that we're seeing with the way coronavirus is impacting communities of color? And I guess how does that shape or impact those health disparities that we see in these communities that are happening right now, not just in New York, but, you know, across the country?
Yeah, it's interesting. You said, you know, now we're starting to see the cases in communities of color, you know, increase. And health disparities is something that we talk about all the time in our program. So, for example, it's not just the difference in, you know, health issues that one population experiences over another based on color or ethnicity. That's really a large part of it. And that's often mostly what we in reports of it. So, for example, I know CNN a week or two ago did a special called The Color of COVID. And I was struck by that. I actually didn't see it, but a few of my colleagues, you know, commented and told me about it. And I was thinking to myself, you know, I looked at the timing, and it was a serious observation that I made. And I'm not saying that this observation is cause and effect. But what I did notice is, because the media is very important in putting out information, when that came out, around that time, I started seeing reports in the news, reports on TV, talking about African Americans, Blacks are, you know, contracting and dying at higher rates. I feel like almost immediately, within a couple of days, I start also seeing a lot of protests. Now, I've been in Detroit, Michigan since probably the second week of March, so I haven't been back to the New York, New Jersey area to see how it's there. But I know here in Michigan, it was almost immediate. And one thing about Michigan's higher rates is that most people, if you are aware, Detroit is a major city in Michigan, and it is still nearly 80% Black African American.
Wow, 80%?
This is also nearly 80%. And Detroit is located in Wayne County. So when you look at some of that information and you say the highest cases are in Wayne County, well, we know Detroit is in Wayne County. Detroit is a city that has a lot of a higher population of Blacks, but also a higher population of people within socioeconomic brackets that might be largely poor or have a larger poor population than other counties. And so what we did see when people in Michigan started protesting, these protesters were largely not people of color, number one. But particularly what I saw was a sign that said, "We are not Detroit." And I said, what does that mean? You know, so that means we are not those people, the large community of people of color who are attracting this disease at higher rates. So let us live, because we're not at risk like those other people. But what that does is end up putting those people at higher risk because they think they're not at risk, you know? So even though we see one community experiencing the disparity, it doesn't mean that other communities are not at risk because you see the higher rate. Now, what happens is, this is where community health workers do become important, because they can give out proper information to disband any myths that people might be, you know, believing in that could be causing some of these health disparities. Because one thing we do know about people of color in this country, particularly African Americans, there's a long history of mistrust between the health community, medical community, and African Americans. I mean, based on experiments that didn't go so well, like Tuskegee experiment, as well as like Henrietta Lacks. So community health workers can help build trust in communities again. We know there's a huge effort in trying to test people for coronavirus. This is where community health workers can explain what the test is about, where tests are, or even be part of giving the test in particular locations, passing out the information in communities to say, hey, you know, we're going to be at this parking lot. Obviously, we can't work indoors anymore, so they may be doing testing outside in parking lots or different places around the city. So this is where our boots on the ground community health workers become really important, because how does the information get spread to those who may not be afforded the privilege to work from home and be on Zoom and on social media and things like that all day? The information still has to get out somehow. So this is where our community health workers can distribute information, can help with testing, can help, you know, debunk myths, and also put out some of the correct information, because there's so much information that has been out here. A lot of people don't know what to believe. So this is where it becomes important. That's right.
Yeah, I've never seen so many Facebook scholars in my life, right? Like, you get on Facebook and Instagram,
absolutely.
Everybody is just an expert. And I guess that's another point too I wanted to get your feedback on. What are your thoughts on the way that the media, you know, is portraying this virus, and, you know, where can, maybe not, you don't have to identify sources per se, but how would you tell people to go about getting accurate and factual information, like in this day and age where information is so readily available? How can people that are from some of these communities that are impacted, you know, where can they go to get, you know, truthful and factual information about this virus?
Right. I mean, just like I tell my students, don't just go to one source for information. I mean, you gotta vet your information. You gotta look at 2, 3, 4 different sources. So, for example, if all you're doing is looking at the news, then get on the internet, look at a newspaper, go to the World Health Organization website, go to the Centers for Disease Control and Prevention website, go to your state health department website, because these are going to be places that are reputable, that are going to have up-to-date and accurate information. Now, some of your other media outlets, they may have information based on what they know their constituents want to hear and want to believe. So that's where you have some of the misinformation that comes out, because one news outlet can say something totally different from another news outlet, and then there's the confusion. People don't necessarily know what to believe. But I feel like, for the most part, with this pandemic, your reliable sources are going to be our most important health organizations that are on the grounds researching and trying to get out the information. I mean, they're the ones that are doing this 24 hours a day around the globe. So I think these are going to be your important sources that you need to look into as well.
Okay, yeah, that's a good point. And that kind of leads to, I guess, the whole conversation we're having around just health disparities and health equity. And, you know, you and I both know, since we work in this space, that long before coronavirus came around, there were health disparities.
Oh,
And
absolutely.
anytime, you know, anytime there's an illness or a virus or a disease that impacts the population at whole, we can almost assume that communities of color, especially African Americans, will probably be disproportionately impacted. So now that
Right.
this highlight has, you know, and this flashlight has been put on coronavirus and its negative impact on communities of color, what would you say are some recommendations, or just some best practices, or some things that we can do to not only address this health disparity right now as it relates to coronavirus, but where do you see this kind of going long term with, you know, how we can improve health equity in these communities?
Well, first of all, you know, a lot of people may not understand health disparities in full and some of the components that come
Mm.
along with it. You know, they
Well,
may,
break it down just a little
you
bit
and
for us.
I
I know we probably need a
understand,
whole
you
year
know,
to talk about
yeah.
that, but just break that down a little bit. That term health disparities, kind of just for
Right,
our listeners and viewers, just kind of break that down just a little bit when we say that.
right. So when we're talking about health disparities, we're talking about populations that may experience health issues, conditions, or lack of health care for various reasons. It's not inherent to race, ethnicity, but multiple factors. So, for example, what's happening now, as much as people are saying, stay at home, listen to our governors and things like that. Well, we know socioeconomics is one of the factors that contribute to health disparities, because poor people are going to be more at risk for health issues. Also, poorer people may be also at risk for not having health insurance, because they may not be working in positions that are salary and benefit type of positions. They may be hourly workers working more than one job, and then they don't have proper health care. They may be underinsured or uninsured. But these are also our boots on the ground people, our essential workers that are going into work every day. They have to still get on the subway. They have to still get in a cab. They have to still get on a bus. So they're constantly putting themselves at risk, even though, yes, they are higher at risk, but they have to. They're also putting themselves at risk for survival. And so when we think about that, also just the stress from being poor, or stress from being a person of color, also is one of those factors. You know, and I'm going off a little bit, but this is important because this is something that I think about, especially women who are pregnant and who will be delivering babies during this pandemic. One of the things, this is a health disparity that's really interesting for women of color. We know in this country, Black women have higher rates of low birth weight and premature births compared to women of other races and ethnicities in this country. But here's where the tricky part is, because I just mentioned socioeconomics also being a factor. But when it comes to Black women, socioeconomics is not a factor in birth outcomes. So a poor Black woman and a woman with a PhD can have the same health outcome when it comes to a same birth outcome. Now, why is that? And that's because racial stress, the unconscious bias that some women face on the job, whether they're in higher positions or lower positions, that's something that does come with being Black in this country. And racism is a stress factor for many Black persons in this country. So when we're dealing with those types of things and we look at who our essential workers are, the majority of our essential workers are people of color who are going to be putting themselves out there at risk every day just so they can continue to make the country run and they can save the lives that are going to the hospital every day. So when we think about why those communities might be at higher rates, that's one of the reasons why. You know, they're being put in the fire every day. And we know across the country, many health workers have gotten sick. Many of our police officers have gotten sick. So what we need to do is really measure our risk and be careful and follow the precautions, because if we're going to be out, you know, like over the past week, A lot more cities have become lenient and loose with opening businesses back up. And one of the things that we have to do is be responsible for ourselves so that we can help the communities be healthier. You know, we are part of the community, and if we all do our part, then we can help make our communities healthier. So put on that mask, wear your gloves, keep your distance. You know, listen. You know, it's a reason we have these precautions out there. So as community health workers and as regular people living in the community, we have to work together to follow these directions and follow these precautions to keep ourselves from being at risk, but also helping to reduce the risk of transmission to others.
Right. That's so important. And, you know, I love community health. That's my background as well. And I believe community health professionals are going to save the world. And public
I
health
hope
too. We'll
so.
bring them on board. We'll bring them on board with us.
Well, we're
But
all
that's so
part of the
important.
same tree.
We all part of the same tree to make it
That's
work.
right.
But that was an amazing feedback and amazing conversation we had today around our community health program, as well as, you know, health disparities and health equity, and some amazing things that the role community health and public health is playing in closing this health equity gap and this health disparities that we see across the country. But before we close out, was there anything else you wanted to add or share with our viewers around our conversation today?
You know, I'll say this because I'm a human being like everybody else, and I know it's springtime and the sun is coming out and the days are getting longer. And after being quarantined for 6 weeks or more, for a lot of people, we're anxious to get out. But I just want to say, you know, it's okay to get out. Most people are saying you still need to have fresh air, exercise, and things like that, but just be careful. Just because we're getting out and about again doesn't mean that, you know, we're off the hook. We still have to remain our distance. We still have to be safe. And you are the most important person in this world. So you got to take care of yourself. And that's what keeping safe and putting on a mask and things is about. It's about keeping yourself protected and also protecting other people from you. So if anything in public health, you know, we learned that hand washing saved lives. Let's do what we need to do to save lives this time too.
I agree 100%. Well, thank you all again. That's going to conclude our conversation this week, a part of our Key Lecture Series, where knowledge empowers you. We want to thank you again, Dr. Echols, for joining us. And thank you to all our viewers that have been chiming in and watching our talks throughout the weeks. We hope that you were able to gain some insightful knowledge that not only can empower your life, that also you can take this and help somebody else in need. So again, thank you for joining us, Dr. Echols, and to all of our viewers. Wish you the very best, and we hope that you stay well.
Thank you. Bye-bye.